because your risk of that is just as high, or you have enough inflammation in the vessels from the high sugars that the numbers of your cholesterol, your pressure, and all that we want as low as in someone that already has had maybe a stroke or a heart attack. And we continue to treat diabetic patients like that because many of my patients will ask me, well, I don't feel bad. Why are we doing all this? Why do I need to take all these pills and check my sugars? And well, a lot of the patients won't feel bad, but it's the end organ damage that we're trying to prevent. We're trying to keep you from becoming blind, trying to keep you from ending up on dialysis, having a stroke, losing a limb. In my male patients, erectile dysfunction. I mean, all this is related to the vascular inflammation that's in your vessels and that affects the blood circulation through the body and then affects these organ functions. So I think when patients realize that, they're like, well, yeah, my mom was on dialysis, I don't want that. Well, this is why we have to kind of intervene a lot earlier before we get to those points.
Yeah, I think a lot of the drugs, but even diet and exercise decreases that inflammatory response. So, put out the fire before you even get the fire is, I guess, the thoughts that we've been having in the last few years.
There's been a lot of discussion in the last few years as physicians, really, do we need to treat all our patients with medications? Diet, exercise plays a huge role. There's a lot of evidence that plant-based diets can reduce inflammation to the point where it may even reduce your risk for certain cancers, most definitely diabetes and heart disease. Sharon, as our lead dietitian, maybe can talk about some of that later. There's a lot of fads with these ketogenic diets going on now where people do lose a good amount of weight. Is this really healthy? What is the best type of diet to eat? And we'll probably let Sharon pick up on that.
That's a great one. We got a little bit more of that coming down the road. But on that note, there's a patient of Dr. Patel's, Gail. Is Gail here? Gail? Gail, just stand up for a minute, please. There she is. Okay, this woman came to me on high doses of insulin and A1C of 11. Just, when was it, Dr. Patel? June?
Yeah, a few months ago.
And
Thank you for coming, Gail.
Thank you. So, Dr. Patel, where is Gail today?
In the 7 range, like 7.6. I didn't know you weren't going to put me on the spot with her numbers, but very good. I can tell you that much.
7.6.
Yes, within a few months.
Off all of her mealtime insulin. Great job. Yes. So that ties into what both the doctors were talking about, because Gail has literally brought her A1C down while reducing her medications just with lifestyle change, just with most of what you're going to see today. Okay, so I mean I'm just so proud of her. So I really wanted her to come for that.
So Gail has done this along with Sharon's help, and we really appreciate your input in helping her. And I think Gail